any sort of, constriction of the vessels, but I'm using a Botox size needle. So this is very, very tiny. The reason I use the tiniest needle is so that we can get into the tiniest veins, because again, we're injecting on the inside. So we choose an area to start. I like to do top to bottom. I'll treat both legs in the same session at the same time. We'll get everything that you've got. So we kind of do this cosmetically based on how much solution and how much time. A full session is an hour. So a little bit of alcohol, and don't be afraid to gather closely so that you can actually see it kind of flush through, because it is satisfying to see.
Have you guys seen it before? Yes, very
Yeah,
cool.
so come close, come close, come close.
You wanna come over here, so I'll do this way.
Yeah, I'm going to position just a little bit here.
Nobody has a cold, do they?
Okay, so Phyllis, we're going to start right there on you,
Go
okay?
ahead.
So a little tiny injection here. I'll move that so you guys can see. All right, so a little stick, 1, 2, 3.
Oh, wow. Yeah.
Now this is one injection. Do you see it tracking?
Yeah.
So I'm just pushing lightly with my thumb to get the sclerosant to go through this. This is called a spider vein complex. Some of these are connected. So this is the same injection, but I'm treating this whole thigh.
Does it hurt?
Nope.
No, you don't feel it?
And you also see how this is the tiniest needle and I'm only using the tip of it. This whole thing is not going in your leg. Okay, so you see how that flushes nicely? That was one injection to treat that section. So now we go around and we treat the rest of them. Some of these neighboring ones, some of these little branches, but now you can kind of see we're getting redness. This is kind of like what Dr. Mayholtz was talking about. Anything that's cosmetic, what we're using is something that irritates the veins from the inside out. That's not painful to you, but you get some redness, you get some inflammation, you get some things that we want to see, right? We want those veins to be irritated. They're going to eventually shut down so there's not blood flowing through them. You're going to compress them. You're going to come back in 6 weeks. We're going to do this again. After that, you should really only need 2 injections, two series, and that's it. The compression both times, the holding off on the exercise both times, then you just set it and forget it, and you let your body just absorb these veins away. After about 2 to 3 months in overall period of time, you should have everything looking really good. If you need one other area touched up, you just call us and you let us know, and I do a quick little 15-minute touch up here and there. Okay?
So, silly question, but if the veins are gone, the blood just knows to go somewhere else? Doesn't
Great
it
question. Yeah, so these are accessory pathways. So the reason, again, this is cosmetic because these are extra veins for you. These are not actually helping to contribute to your venous return, your circulation, anything like that. So these are accessory pathways, again, with genetic origin. So shutting these down, you're not losing out on anything. Yeah. Also, veins are kind of remarkable. When you have the big varicose veins and those get treated, the same thing can be true. Our arteries cannot do that, but our veins can reroute the blood to the deeper system, and you have normal circulation again.